All right, we're going to move on to talking about when psychological health deteriorates and kind of leading into where we could go for help and looking at different professionals in the field. So, defining mental illnesses, what are we talking about? These are disorders that disrupt thinking, feeling, moods, and behaviors and cause varying degrees of impaired functioning in daily living. How do we determine if something is actually a mental illness or not? Professionals in the field would use the DSM. This is Diagnostic and Statistical Manual of Mental Disorders. So if a particular issue makes it as a mental disorder, it will be listed in the manual, and 22.5% of American adults suffer from at least one mental health illness or disorder. Many people with mental disorders are receiving no mental health services, and one of the things that can be debatable is what causes these issues. Could be biological, genetic, could be environmental, stress. We definitely see when there's stress, trauma, like abuse, anxiety, loneliness, financial issues. These are all things that can kind of derail how people cope and lead into mental illnesses. When we look at college students, we see that mental health issues are definitely common among college students. 1 out of 4 are stating that they do experience a mental health issue each year. And the 2 most common are anxiety and depression. And we also are seeing an increase in ADHD or attention deficit hyperactivity disorder. And it could be because it's being screened for more, or there is some concern that it might be overdiagnosed or misdiagnosed. And depression is really common, and most adults or even teens at some point are going to go through a bout of depression. So what is that feeling? So it could be that they felt that things were hopeless, and then it could even maybe be that feeling of overwhelmingness. There's so much going on, so much to do. Can they keep up with it all? But when we start to feel that it's just too difficult to function and we're considering suicide, it really needs to be something that we recognize that we do need to get help. So suicide is an issue that we do need to look at seriously. As far as leading cause of death, it is one of the leading causes for younger people, 15 to 19 years old and 19 to 24-year-olds. And men do have higher rates. We also see then the rates increasing again in the elderly population, and we'll talk about that when we get to aging. We see higher risks for the lesbian, gay, bisexual, and transgender students, and we also want to note that when we talk about self-injuries such as cutting, this is a coping mechanism, and this is not an attempt at suicide. But it's still something that is concerning and a lot of times is associated with mental illness, whether it's anxiety or depression. So what are the warning signs of suicide? Recent loss, an inability to let go of grief. If there's a history of depression, we might see a change in personality, such as sadness or withdrawal, loss of interest, and possibly sexual dysfunction. But oftentimes people report they didn't see any signs, so that can happen also. Some other signs might be expressing that they hate themselves, major changes in their sleep or eating habits, kind of direct comments or even indirect comments about not being around anymore, final preparations, maybe kind of being preoccupied with planning their death or death themes, and maybe even a change in their personal appearance. So preventing suicide, one of the big things to do is, take any threat seriously and monitor any of the warning signals. Let the person know that you care about them, listen to them. And a lot of times what therapists do is they'll actually ask outright, are you going to be safe? Are you thinking of hurting or killing yourself? And just be very, very direct and not skirt around the issue. Another thing that we as non-professionals tend to do is say, it's not that bad. You're going to be fine. Stop taking everything so serious. So we have a tendency to belittle or downplay the seriousness of what they're feeling. So another thing that you want to do is maybe make sure that you do link them up with some help and make sure that someone else knows that this may be a serious threat, because it's way too much to carry on yourself. So how do you know if you need professional help or if someone that you care about needs professional help? If you feel out of control, you feel that your emotions are inappropriate or there's a lot of mood swings, if you are beginning to withdraw from others, if you're feeling that your life is worthless or you're hopeless, if you're considering suicide, they also have here hallucinations. I think that would be very rare in many of these cases, but that would obviously be a situation where you might need some help. And if you are turning to drugs or alcohol to escape your problems, or shopping or gambling or sex, any type of addictive behaviors that you may find yourself engaging in to cope. A lot of times people don't want to get help, even if they know they have an issue, because there is a stigma surrounding mental illnesses. And so they don't want to be labeled with a particular illness, and they don't want other people to know that they may have any type of illness. So we just kind of bebop around acting like we're perfectly fine, while internally we're not. So 1 in 3 college students identify that there is a stigma that will keep them from getting help. And so when we talk about stigmas, it's a negative stereotype about a group of people. So most people with mental illness are not dangerous. They live independently. They're productive members of society, and they should be applauded for getting the help that they need if they are seeking treatment. So a lot of times the stigma is going to lead to feelings of shame and isolation, and therefore cause a delay in treatment or care, which can be dangerous for that individual. So how does the whole process go of getting evaluated for possibly a mental health issue? Generally, what you could do is start by going through your regular family doctor and having a physical checkup, and kind of rule out that it's anything physical that's going on with you, and then they would have you go to a psychological health professional. All right, so there are a host of mental health professionals out there, and it really depends on what your needs are and maybe even what is available to you. So we have psychiatrists and psychologists as our top 2. And when we talk about a psychiatrist, they are actually a medical doctor. They have an MD and they can prescribe medications. Psychologists have a doctoral degree in counseling or clinical psychology. They cannot prescribe any type of medications. A clinical psychiatric social worker has a master's degree in social work. So that is the next step below a psychologist. They are trained in counseling. A counselor has a master's degree in counseling, and they may be able to run group therapies and things like that. A psychoanalyst is a postgraduate degree in psychology or psychiatry. And then we have a licensed marriage and family therapist. So these are really more like master's or doctoral level individuals who work specifically with family and marriage issues. Before you select a mental health professional, you may want to talk to them on the phone, kind of get an idea if you're actually going to like this person, if they are professional, if they're going to have time to meet with you on a regular basis, or at least to the degree that you would want to meet. A lot of times people would like, a weekly appointment. So what do you expect once you have selected a professional to work with? You want to explain your needs. You want to make sure to ask about fees, make sure your insurance works with them. The therapist is going to want to take down your history and details about the problem that you are bringing up in therapy. One of the key things is to be really open and honest so that you can work through those issues. Do not expect the therapist to tell you how to behave. The responsibility for improved behavior lies with you. So what the professional is going to do is they're going to use what they've been trained in, which are these treatment models or types of therapy. So the first one is often called CBT, which is cognitive behavioral therapy. And this focuses on the impact of your thoughts and ideas. And this is the most widely used and accepted form. And it's definitely proven to have success. It's getting people to kind of draw out what they're thinking, what they're feeling, and how it's impacting their behavior. So if we can start to change their thoughts, then we might be able to change their behaviors. Psychodynamic therapy focuses on the psychological roots of emotional suffering, and interpersonal therapy focuses on the social roles and relationships. And so that would be something that is probably used more in your family and marriage type of therapies. Pharmacological treatments. This is looking at drugs that we would use to treat some of these mental illnesses. Psychotropic drugs are widely used, and these are drugs that alter mood, emotions, and behaviors. There's a lot of side effects to them. This is a huge market right now, so sometimes you kind of have to, if you are going to be prescribed these, you try one type or a certain dosage and then kind of monitor that to see if it works.